community meeting, community health meeting?
We've just been calling it the COVID community meeting.
You're live.
Thank you.
We're live, Greg.
Do you have us muted? You have us muted.
Here, okay. All right, we're live, Greg.
Okay, welcome everyone. It's July 16th, and this is the COVID community meeting. Normally, I think it's a Pitkin County meeting, but today we're joined by some Eagle County and Garfield County representatives from the epidemiologists from the health departments there, and we'll get to introductions shortly. We've got looks like a pretty full schedule in the next hour, so we're going to fly through this. I have Josh Vance, who's our Pitkin County Health epidemiologist. I have Rebecca Larson from Eagle County Public Health and Sarah Brainerd from Garfield County Health. And then also we're joined by Tracy Truelove, who's our information officer, and Dave Ressler, CEO of Aspen Valley Hospital. So I wanted to just say welcome to everyone. And I think that the opening message I get to make is just to touch on the topics that are swirling around lately, and personal responsibility is really coming into play here for COVID in our community. Gathering size has become really important. It turns out that limiting gathering size to an immediate family, as cases we're seeing are more to do with social gatherings when it comes to contacting COVID, even more so than maybe visiting a restaurant or a grocery store. So we can talk about that, but I think what it's coming down to is everyone really needs to pay attention. And the other thing that's been on our minds lately is, boy, how long is this going to go on, and will we be facing this economic and pandemic crisis as we go into ski season, and what will the ski season look like? All we can say at this point is that everyone is preparing for this, and so there are people thinking about it and making plans, but the decisions we make now as individuals around complying with the public health orders are going to really affect directly what happens in the late summer and in the fall going forward. It will affect whether our children are going to school or not, and how they're going to be participating in their own education, and what winter will look like for Pitkin County and Aspen. And so I think what we all need to do is pay attention to the data. If we want school to function, if we want skiing and the tourism economy to function, we need to pay attention. And really, this is new to all of us. No one has been through a pandemic like this before. So that you can give everyone a little bit of leeway and say, let's all be cautious and careful and err on the side of caution. So having said that, I want to bring up, to get us started, one of the things we're doing, which everyone can participate in, is we're calling it the I Wear a Mask campaign. And this is something we started locally. Board of Health, Dr. Tom Kurt suggested it, and we started following up, collecting photographs from citizens. And if you could pull that up, there we go. We have a campaign where we're collecting photographs from citizens, people, influencers, anyone who wants to model behavior on how to get through this pandemic. We're having them send in photographs wearing their mask and a quote on why they wear one. And it seems to be taking off. We've got a viral message going. We have World Extreme Ski Champion Chris Davenport. We've got the Mayor of Aspen, Tori. We've got social media influencers like Kid Master. We've got Board of Health members, Tom Kurt and Jenny Siebold and Linda Vieira and many other people. We've got our former sheriff, Bob Broaddus, who has a very strong message on wearing a mask. And we invite everyone in the community to send us a selfie wearing a mask to pio@pitkincounty.com and include a quote on why you think it's important for us to wear one. And we will publish it, and we're going to try to make this go viral. We want everyone to realize modeling a mask is right behavior, and it will get us through this. Having said that, that's my campaign announcement for the day. I think, send us your pictures. Up first, we're going to have Josh Vance, who's the Pitkin County epidemiologist. Josh, take it away. And I think you've got to leave early, so we'll field questions for you at the end of your presentation.
All right, perfect. Give me one moment.
Did I miss anything? Anybody? Did I leave anybody or anything out? I think we're good, so still on track. And also, aren't we grateful for the rain? My God, I'm so glad to have it raining here.
All right, Greg, I'm ready.
Okay,
Sure. So I'm going to provide a brief update on the epidemiology and the data that we're seeing here in Pitkin County, but also across the state, and then also across the nation, and then discuss contact tracing and why that's so important for us to be participating in at this time. And then Becky and Sarah from Eagle and Garfield will present after me, and they'll discuss what they're seeing in their own county. So the first thing I want to show are the hospitalization rates across the U.S. And really I want to show what we're seeing, what we've been seeing for the last month or so. And so you'll notice
we're not seeing it on our screen yet.
Oh, we don't see your presentation just yet.
Thank you. I'm on the wrong one there.
There we go.
There you go. Sorry about that. So when we look at this graph here, this shows the number of hospitalizations across the entire U.S. So on the left-hand side, you'll see the total number of people that have been hospitalized, and on the bottom, it's by month. And so you'll notice that we had a pretty large peak in the middle of, or at the end of April, beginning of May, and then it began to really decrease over the next month or so while people were wearing masks and while they were distancing and while we were adhering to our 5 commitments. And what we've seen recently in the last month is that hospitalization rates have really began to pick up. And we expected to see this because we were seeing cases increase pretty dramatically starting about a month ago. And so we knew that hospitalizations might follow that. That's really what we're seeing. We're almost reaching the peak that we saw back in late April or middle of April. And we're really reaching that peak again. And this is concerning because you know, if we don't have the hospital beds for people to go to when they need them, then you know, we really begin to run a risk of not getting the people the care that they need. So this is a very concerning number. It's nationwide. We're beginning to see increases across the state, but this should be an alert for us to look at these numbers here. Something I want to touch on too, why COVID is not the flu. I think there's a lot of misconception that, you know, this is just the flu. And really, this isn't just the flu. This is a lot different. This is a brand new disease. As many of you have heard, this is something that we haven't seen before. We don't have a vaccine for it. And so distancing and wearing masks is really the best method we have right now to contain this thing. This graph here shows the number of deaths from all causes as reported by the CDC since January of 2017. And what you'll notice is that as you look across the graph from January up and through about January or February, we didn't have what are called excess deaths. And excess deaths means that we're having a lot more people dying from something and we're not sure why they're dying. And so each plus sign indicates when there's that excess number of deaths across the US. And so if you look back 2017, 2018, 2019, even during our flu seasons, we're not seeing that excess death. We expect that, you know, there's going to be some increase in the number of people that have died during the flu season. But when you look at March, April, and May of this year, you'll see that there is just a steady increase of excess number of people dying. And that means that we have a lot more people that are being affected by this than really we're even aware of. You know, we get the death counts posted each day, and each state will post their death counts, and the CDC will tally those. But we're seeing just a dramatic increase in the number of people that are being affected by COVID. And so really I wanted to show this slide to show that, you know, this is impacting people. It's impacting a lot of people. And just because it doesn't maybe impact us right here, maybe we don't know someone with COVID or someone that's been severely affected by COVID. I think the numbers here speak for themselves. We're seeing just a large increase in the number of people that COVID is having a severe impact on. This is just a graph showing the total number of cases per day across the U.S. I just want to show this. I think everyone's pretty well aware of what we're seeing, but we're seeing a very dramatic increase in the number of cases across the U.S. We reached our highest peak, highest number of total reported cases at any point throughout the pandemic just last night. This is what we're seeing here in Colorado. Same kind of idea. We saw same as the hospitalizations. We saw a peak right here in April, a decrease, and now we're seeing it pick back up again. Of course, this is always concerning to see our hospitalization rates increasing like this. Just today at 12:45, the governor issued a mask mandate. This mask mandate was decided to be put into effect because of what we are seeing in our numbers. We're seeing that increase in case counts, we're seeing the increase in hospitalizations, and this is really the governor's attempt to prevent or to work to prevent continued spread, to ensure that our hospitals remain, able to allow people in and remain at proper capacity. But if we continue to see more cases, we're going to continue to see more hospitalizations. And so this mask mandate was put into effect, ordering that every Coloradan who is older than 10 years old required to wear a mask or face cover when they are in indoor places. So this was issued today. I believe it goes into effect tonight for tomorrow. But this is brand new news today, and it really just emphasizes the seriousness of what we're seeing right now and the seriousness of this disease. This is Pitkin County. These are the cases that we've been seeing, and it's reported by day. So each blue bar represents the total number of cases we've seen per day. So you'll see again, back in April, we saw a spike, it decreased, and now we're beginning to see a large uptick. The red line shows the total number of cases that we've had reported here in Pitkin County residents over the past 14 days. And so you'll see that red line has really just begun to increase dramatically after 4th of July. And so we're just seeing a very steady increase. This number doesn't include individuals that visit here or people that may be here temporarily. We still investigate and we still look into those individuals, but they don't count on our case count. They go back to the state or county of residence where they're from. So I really want to discuss what our role here is at the health department, and not just our health department, but Garfield, Eagle, and the rest of them as well. And it's this boxed in strategy. And what we do is we ensure that people that are sick, that they are isolating. We also ensure that people who have been exposed are quarantining. So this really starts with the testing piece. We want to ensure that we have enough testing in our county to ensure that when people have symptoms, they're going to get testing. And so Aspen Valley Hospital has been our biggest proponent and partner here with this and really ensuring that we have enough testing. And Dave Ressler will discuss that, but testing is widely available and testing is there for people that need it and people that are symptomatic. When someone gets tested and they test positive, we get informed of that result here at the health department. Our role is to contact those individuals who have a confirmed case of COVID-19 and ensure that they remain isolated until they are no longer infectious. In general, isolation lasts about 10 days. And we ask people to remain isolated, which means remaining at home, away from other individuals for that period of time to ensure that they're not infecting other people. While during our interview with that individual, we also asked them who they have been around. And the reason why we asked who they've been around is because we want to try to identify anyone that may have been exposed to the virus so that we can then tell them and ask them to quarantine for at least 14 days. And the reason why we asked them to quarantine just because they were exposed is because these individuals may not have known they were exposed. They may not know that they currently have the disease. And in order for us to continue or to prevent this from spreading, these individuals need to be quarantined. The tricky thing about COVID-19 is people don't always know they have it. There's a lot of asymptomatic individuals. And so when we have identified that somebody might be exposed, we're gonna call and we're gonna state that quarantine is needed for 14 days just to ensure that this doesn't spread. And so the cycle basically continues. If one of those individuals that has been quarantined develops symptoms, well, then we're going to want them to get tested. And then we're going to end up isolating them, interviewing them, and then the cycle, it's cyclical and it continues. And this is really our best method at containing this virus. We don't have a vaccine right now. We don't have, good treatment. We have antivirals, but we don't have the means to really, prevent this. So this is really the best method that we have right now at this point, is to box it in and to follow these 4 steps. And so real quickly on quarantine. Quarantine is, the definition is used to separate people that have been exposed to an infectious disease from others who are not yet ill in order to prevent the spread of it. And so it takes anywhere from 2 to 14 days from the date that somebody is exposed to COVID until they develop symptoms. That's why we ask that people remain quarantined for 14 days, because it can take up to 14 days from the time that you were exposed until you develop symptoms. So we really look at the information that we're given and we calculate it out and ensure that the data that we're giving to people that we speak with is consistent with this information here, that they're being quarantined from 14 days until the last day they were exposed. And so some people ask, why can't we just quarantine until I develop symptoms? Why can't I just wait to quarantine until I develop symptoms? And the reason why we ask people to quarantine even when they're feeling okay is because people with COVID-19 can be infectious while they don't yet have symptoms, and are actually most infectious right before you develop symptoms. You might be feeling fine. You might feel like you don't have any symptoms. You may not feel like you have the virus, but you may actually be the most contagious at that point. And so that's why we request that 14-day quarantine from the last day that you were exposed, to ensure that you're not accidentally or inadvertently spreading the virus. And so, the importance of contact tracing is this: if a red person is somebody that has a disease, has COVID, and the black silhouettes on there are individuals that have been exposed, you can see that this can kind of quickly spread. So even if the red individual is only infecting one other person, it triggers very quickly, and this turns into a chain reaction and begins to spread, and a lot of people are involved very quickly. And so our goal at the health department is to contact those individuals and really try to prevent that transmission. If we can stop one of those red individuals from getting the disease, and we stop them in the tracks, then we prevent all of these individuals over here from getting the disease. And so that's really our goal here with contact tracing. Last thing I want to talk about is non-compliance that we've seen recently. And there's two main things here. One is unwillingness to quarantine. And so when we call somebody stating that they've been exposed, it means that we have reason to believe that they've been exposed. And so we ask them to quarantine for that period of time. We're not calling just anyone to ask them to quarantine. We're asking people that have been exposed to quarantine because we believe that they may have the infection. And so we really need compliance with quarantine. And then the second thing is, when we call, we expect a call back. We have important information to share. And so, we want to inform you that you may have the virus. You may be inadvertently spreading the disease, and we want to ensure that, we can ask you to quarantine. So really the best method we have right now to return to normal is to box it in, is to use this method here and to ensure that we are suppressing the virus. So until we have a vaccine, isolation and quarantine are really our best methods that we have to contain this, and we really need everyone's cooperation in this.
Great, thanks, Josh. Now I think if we have questions, Tracy, I'm just going to ask your help on that. If we have questions from our panelists, anything that we want to put forward to Josh, I know he's got to leave soon. I don't see anything coming into me. Josh, if we have a chance here, I did have an email earlier from today, and I'd love to ask you a couple of these questions. Dave suggested you might be able to help us. And it's really about how are we working with our essential workers. The question is, what's the experience of an essential workers experiencing symptoms of COVID-19? Aspen Times has reported that 25% of the current cases are from workplace spread. And I think I sent them to you in advance. I think what the person is doing is actually just imploring that we take care of our workforce. And maybe you can elaborate on that.
Of course, Greg. Yeah, and those numbers are right. About 25% are occurring, in places of business. And so each time we get a case in somebody that works in one of those organizations or businesses, we're really working with that individual, working with the business. We understand that there are essential workers and people that need to be at the job. But when someone's sick and they're not feeling well, the best method with any illness, aside from COVID, is to stay home and to get better. And so if somebody is not feeling well, then that's obviously our best course of action there. If somebody's been exposed, an essential worker has been exposed to someone with a disease, then we really work with that organization as well. We take the CDC guidance, which actually enables essential workers to return to work if there's a need for it, in order to mitigate staffing shortages. And so we work with every single case. We try to figure out the best solution. We work with the employers as well. But we also want to ensure that we're not spreading the disease as well. So again, we take every single case, as a case on a case-by-case basis, and really just do our best to ensure that all parties are getting what they need from this, while also ensuring that those who are sick are able to stay home and rest and get better.
Great. Thanks, Josh. A couple more while we're on it here. You mentioned that the graph you showed earlier was for county residents. This is a question from Alan, but it said visitors were not included. If you could just reiterate why this is the case. And the question it goes on to say, if visitors are included, how much larger would the daily running incidence rate be? Is there any way to track that? Yeah, and it's really difficult to track that information for a few reasons. One, somebody could visit Pitkin County, and we may never know that they were here while they were infectious. They may go home, they may get tested, and we'll never find out about it. So we missed that piece of information. Secondly, if we include individuals who were just visiting here or have traveled here, there's a concern that we'll begin to double count our numbers. So we'll count them here in Pitkin County, and then those numbers will get counted at their home jurisdiction as well. So we want to do our best to be diligent in the numbers that we're reporting, ensuring that we're not accidentally double counting these cases, and then when these get reported nationwide, there's misleading information about the actual number of cases we have. So we really only report our county residents, and that's what other counties do as well. They report cases in their county residents. They don't report travelers. It's very tricky to do that. It's just very complicated. And since we won't have all the information, it could also be somewhat more misleading because we can't provide you with all that information of all those who have traveled. We only have a handful of the cases that we hear about. Whoever asked the question is correct in saying that yes, it would increase. Our graph would look a little bit larger, but I think that the trend would look the same. So while there might be an increase in certain places, the trend would remain the same. We'd still be seeing a spike right about now, and I think the strategies are still the same. Great, thank you for that. It's good that we have both our Garfield County and Eagle County epidemiologists here, because of course, if somebody's visiting as a guest worker coming up and working in our community and then going back and they contract it there, the numbers from those counties actually make a difference to us as well. But thank you for elaborating that when we show numbers, these are Pitkin County residents, and those are the reasons. If I've got one more here before we move on, I'm going to take the second half of it. And the question is, they're curious, does Pitkin County report COVID cases to CDC or Health and Human Services? That might be a Dave question, but I don't know if that's for you as well. I think you've answered how the COVID cases are counted. There's a big effort not to double count is the gist of what I heard you say. Right. So when we have a system here called CDERS, it's the Colorado Electronic Disease Reporting System. And so each time we get a confirmed case, we submit that case into that system, which goes to the state in Denver. Denver compiles all the data, and then that data gets shared with the CDC. Got it. Great. Thank you. I think I think we're going to let you go unless there's something else. If somebody else with us has a question for Josh, I know he's got to move on. Thanks for coming, Josh.
Hey, Greg, what I would suggest is that we go ahead. I want to make good use of our other panelists' time. And so if there are some other questions coming in, we'll get them at the end. And if we can't answer them, we'll follow up with those.
All right. Thank you. And that way we can keep it moving. And thank you, Rebecca and Sarah. We're going to get to you very shortly here. So Josh, thanks again. And I'm going to move it over to Rebecca Larson, who's the Eagle County Public Health, with the Public Health Department. And we're looking for a regional snapshot from Eagle County's perspective.
Sure. Thank you for inviting me to your community meeting. On an Eagle County perspective, first of all, I want everyone to know that we work closely with Pitkin and Garfield County Public Health. I think we might now have 5 weekly meetings between our departments on a variety of topics. There's a lot to discuss. And then we probably communicate back and forth multiple times a day, especially around those case investigations and contact tracing that Josh mentioned. Similar to Pitkin County, we're also seeing an increase in prevalence of disease or disease activity. We have almost tripled our cases in a 5-day period. So that means from July 1st through the 5th, and then from July 6th through the 10th. And it's concerning. I'll be honest, and I think our trends are very similar to what Josh mentioned as well. So I'm going to give kind of a breakdown on what those trends look like in that 10-day period. So that's July 1st through the 10th. 41% of those cases have had close contact with a known case. So that gets back to, in that box it in strategy, those that have close contact, meaning they were within 6 feet of somebody for a prolonged period of time. That's 41% of those cases in 10 days. 6% of our cases have had exposure outside of Eagle County. So they traveled elsewhere and were exposed there, but they're Eagle County residents. And then 53% have an exposure that we can identify. So we kind of say that's our unknown exposure. And the reason why that's important is a few things. It is extremely important for us to keep our eyes on the virus in this pandemic. That helps us manage the disease activity and the level of disease transmission. And when we start to see that number increasing, that number of unknown exposure, it becomes harder and harder for us to keep our eyes on that spread of illness. And when we get to that point, that contact tracing becomes less effective as well as a strategy to mitigate illness, because then we're starting to see more widespread community transmission. So just to put this in perspective, that 53% I mentioned, 2 weeks ago, that number was at under 25%. So that's a big change in a 2-week period of time, and speaks to kind of some of the challenges we have within our community around managing the illness. Not only is there kind of responsibility of individuals, but also of our businesses, making sure that we're having those social or physical distancing protocols in place so that our employees have distance between other employees, as well as customers are wearing face masks, good hand hygiene. So it kind of runs the gamut, but also for individuals, if you're sick, to stay home. And this is probably the hardest part, is staying home and self-isolating. And then for those close contacts, especially those family members, choosing to stay at home to quarantine before public health gets aware of those test results and contacts you. So I'll be honest, the box it in strategy is what we across all of our counties are doing. But right now we're having some challenges. For one, we have some delays in testing. This is not unique to Eagle County or Garfield or Pitkin. This is really nationwide, but it's taking about, on average, probably 7 to 8 days to get those turnaround times. So as you can see, that box it in strategy is dependent on that test result. And if it's taking that long of time, it becomes less and less effective. So it's really important that if you have symptoms, and regardless of if you choose to get tested or not, please stay home. Please isolate from others. And if you are a family member, please quarantine. You're at higher risk for becoming infected as well and furthering that transmission of spread. So please don't wait until a healthcare provider or public health calls you to tell you this. It's important we all recognize what we need to do without further instruction or waiting for that test result. Let's see what else in Eagle County. And a lot of people, Eagle County, we have 2 different valleys, so to speak, Eagle River Valley and the Roaring Fork Valley. We always get questions about, well, how much is this occurring in Eagle River Valley? Out of that 10-day case numbers, 35% of those cases are occurring in the Roaring Fork, Eagle County area of our community.
Great. Thanks, Rebecca. I did have a question here. It just says, when you're talking about 40% of cases from July 1 to July 10, how many positive is that? Or I'm assuming they're all positive. Is that correct?
Yeah, so it's so far 93 cases. 93
cases. Okay. And you said 35% of the cases you're seeing are from the Roaring Fork Valley part. That was my question. And
That's
then
correct.
What's the threshold when we just determine something it's community spread is becoming a very popular term, like social distancing? What threshold does it reach when it's identified as community spread, and then contact tracing becomes less important to us?
Yeah, this is a great question. You know, there isn't a magic case count number that determines that. For example, back in March, we identified community spread after 3 cases. So it's not based on case count, it's based on the information we're obtaining from those case investigations, which are so important to give us information about what's going on in our community. So part of it is that unknown. What % of our cases can we not identify that exposure, where we can't link it back to somebody else or something else? That's a big piece of it. Another piece is around being able to investigate cases and contact trace. Are people willing to provide the information and it's accurate so we can further follow up to prevent further spread? Because we know for every case we're unable to get a hold of, right now our average is about 8 close contacts quarantined for every case. So if we're not able to get a hold of one case, that's 8 people that we know are more likely to become infected and then further spread that. So that threat of transmission will continue without any intervention.
Great, thank you for that. I think we're going to move on to Sarah, unless someone else has something for Rebecca. You'll stick around, right? So you'll be here if we need another question. Sarah Brainerd works with Garfield County Public Health. Take it away, Sarah. Thanks for being here.
Thanks for having us. We really appreciate, like Becky said, we work very closely with Pitkin and Eagle County down here in Garfield. As you well know, our residents in Garfield actually are many of the service employees working in Pitkin and Eagle County. And so we are definitely seeing that with our trends of illness as well. Currently, we're reporting out 439 cases, 64 of those being reported in the last 2 weeks. And about 40% have had close contact transmission too. I think it's closer to 50% now. It's constantly, our numbers have been climbing quite a lot in the last 2 weeks. And as mentioned, our contact tracing is the most important piece that we have right now in any chance of getting people to isolate and quarantine appropriately to stop further spread. And we are really seeing that close contact is the way it's being spread. Workplace, households, we have about 61% of our population that is Hispanic, and about 50% of our cases are presenting from Glenwood Springs and Carbondale, so kind of that Upper Valley region for Garfield. I think that covers our stats. As far as you know, looking at our service industry and people working in Eagle and Pitkin counties, and then bringing it back to their households here in Garfield is definitely a common trend that we are seeing.
Great, thank you, Sarah. One question right off the bat is, how many hospitalizations do you have in those numbers?
You know, I was actually just trying to pull it because we've been thankfully having some discharges. And I believe in the last 2 weeks, we had 4 hospitalizations on those cases that I just reported on.
And then you mentioned 61% is the population number for Latino community. Is that the population of the community, or is that the number of cases, 61% of the cases?
Thank you for clarifying. That 61% of the positive cases are Hispanic or Latinx.
Okay. So they're getting the brunt of it. It seems.
An alarming disparity.
Right. And then also, while we're on it, Rebecca, regarding hospitalizations in Eagle County, that was a question that just came in as well for Eagle County.
Yeah, so we've had 3 hospitalizations in that 10-day period.
Okay, great. Thanks.
I think it's important important to note too that as we see the increase of prevalence in our communities, it increases the risk across all ages, younger to older, but also increases, like, we will likely see more severe illness as we're increasing our disease cases and prevalence.
Okay, more severe illness expected if we continue on this course, is what I think to reiterate. Thank you. All right, thanks, Sarah. Thanks for backup. We'll probably have some more questions coming in. Next up, we've got Dave Ressler, the CEO of Aspen Valley Hospital. Dave, you've seen some of the questions. Take it away. We'll follow up with more questions after.
Okay, great. Thank you all. Thank you for the discussion and the opportunity to be here today. And I will just jump on board with our regional theme. We too, as hospitals, have enjoyed the close collaboration between ourselves, representing 4 hospitals in our 3 counties. We have Dale Health, Valley View Hospital in Glenwood, Grand River Hospital in Rifle, and ourselves. And we too have kept in close contact and are doing everything we can to both share resources and ideas, and also to be able to work together to have a common approach to our work with our counties. So on that note, let me start with talking about our matrix and the status of our capacity, which is available on the website for Pitkin County and on the COVID part of the website. You'll see statistics. And we continue to be cautious with regard to the amount of testing that we're doing. We are exceeding the 16 tests per day, which was established as the threshold at which point we moved from comfortable to cautious. And we've been there now for about a week. And we'll see if it starts to back off a little bit. Certainly during the July 4th weekend, we had a considerable amount of activity. When we increased or surpassed that threshold of 16, we actually doubled our capacity to 32 and are open on the weekends as well for symptomatic people requiring testing. As it relates to the other criteria in our matrix, within that same category of daily visits where you'll find our testing, we have 2 other types of visits that we are tracking. One is emergency department visits, and the other is visits to our respiratory evaluation center. Neither of those at present is surpassing the threshold that would push us on their own into that cautious category, but they are both climbing and approaching their respective limits, which you can see in the matrix. And that isn't too surprising when you think about the cycle of the virus, starting with minor symptoms, which is what prompts people to contact their primary care physician and be referred just for a test. They don't need care. At that point, they're just, they and we appreciate the fact that they're doing so, are making sure that they don't have the virus.
Hey, Dave, pardon me just for a sec. Did you have a page to share, or were you sharing a screen, or
no?
Just, oh, you're telling us. Okay, I just want to make sure I wasn't missing something. Thanks.
Yeah, we're just talking here. So, and answering questions. So we do anticipate, again, seeing that rising rate among patients with now increasingly moderate symptoms presenting to our respiratory evaluation center and emergency department. We think those numbers will continue to climb. And I'll answer the question about hospital admissions that was asked of the other counties. We have not had an admission for several days now since the week of the 11th. On July 6th, we transferred 1 patient to a higher level of care that was acutely ill and required to be sent to a lower altitude and a higher level of care. So that too is at the end of the path, if you think of it that way, the downstream effects of the spread of the virus in the community. So we consider the testing, the fact that it's high or the numbers are large, to be an accurate early indicator that we're going to start seeing the hospitalizations like Garfield County have seen. So we are keeping a close eye on that. And then the final indicator in our matrix is our staff, our essential hospital workers that are out ill. There again, we are not seeing a rise in that yet either. We're still comfortable. We only have a couple people that have tested positive, and we are comfortable there as well. So my bottom line on behalf of Aspen Valley Hospital is we are cautious because our tests are up, but that is a highly predictive early indicator that we're going to see increased activities in the hospital and the other areas downstream. So I'd like to talk a little bit more about testing specifically. This is an area that is confusing, frustrating, very helpful, depending on how well you understand the process and what we're trying to accomplish. And here again, this is where we have worked closely with our Pitkin County Public Health and enjoy that partnership very much, and with our colleague hospitals that I just mentioned that have their own relationships with their counties. And we are developing and have been maintaining a high degree of consistency between ourselves about the approach to testing, when to get tested, et cetera. And as a matter of fact, we're continuing to work together. We just met the other morning on a regional testing strategy that Sarah and Rebecca have been involved in, as well as our public health team. So I think that's very important to be able to allay confusion and to try to make sure that we're approaching our work collectively, because there is so much migration. We're very permeable between our counties. We have people that live mostly down valley and work up valley, so we really have to continue to work together to make sure we're boxing in the entire region. With respect to testing, I'm going to break it down into a couple different categories to try to make it as simple as I can. And the first one is for those that have symptoms. This should be a now familiar message to you. Certainly if you are seeking treatment or you need help managing your symptoms, then when you access services at Aspen Valley Hospital, either in our respiratory evaluation center or in the emergency department, or if you are admitted, you're going to be tested in every one of those circumstances, and you're going to be rapid tested, because we're going to want to know as quickly as possible whether or not there's going to be a positive test result. So again, those are the people that are accessing us for assistance with managing their symptoms or treatment or care. The next symptomatic category, though, is those individuals that have minor symptoms that don't necessarily need medical care, but this is what the messaging as part of the 5 commitments to containment references. It's the 5th one, as a matter of fact, that if you don't feel well, number 1, that you stay home. That's the 4th commitment. And then number 5, that you get tested. So I do have a couple questions, Greg, that you provided to me that I'd like to speak to about that testing process and what to do. So if you do have symptoms, call your primary care physician. That primary care physician can be here in town, anywhere in the county, anywhere in the country. And ask your primary care physician for a referral for a test. And if they agree, that's what they will call us and order that test, and we will provide it to you. Importantly, there will be a physician involved who can interpret the test for you and talk about the limitations of that test and what the results mean. The questions that came up are, yes, we do require a physician referral. Well, what if somebody doesn't have a physician? And so if that is the case, if you do not currently have a relationship with a physician, then call our primary care practice, and we will be happy to provide that physician contact and order the test following a physician consult. The question was ask, well, how much does that cost? Because that is, there is a charge associated with that. And generally speaking, we are doing these all by telemedicine. And it's about $75, but I want to be clear, we're a community hospital. If you can't afford that, we'll work with you. We'll and ultimately provide it to apply it to charitable care if it truly is something you can't afford. We do not want any barriers at all to getting a referral for the testing. Once you receive the cost for the test itself, will be billed to your insurance company if you have one, and because we are required to do that as part of our responsibilities to the federal government through the CARES Act. We will not ask you to pay the balance, however. If your insurance company only covers a small part of it, we will not come back to you for the rest. If you're not insured at all, there will be no cost to you. So there will not be a cost to the individual for that test. The next question that was asked was, if you do require treatment, what does that cost here at Aspen Valley Hospital? Well, it depends. Because if you're just coming into our respiratory evaluation center, that averages about $150 that we will bill to your insurance company. Once again, if you don't have that, we apply those services. We'll work with you on payments or apply them to charitable care. If you require the emergency department and chest x-rays and ultimately are admitted, it depends on what the total cost of the services are. I can't really predict that. So, Greg, I hope I answered your constituent questions with regard to that.
Dave, thank you. I think that answers. We can go on in Board of Health and elsewhere and talk about if there are any cracks that people fall through, say workforce that are having trouble worried about the payments, and if there are costs. It sounds like you have structure in place, but we'll be paying attention to that. Thank you, Greg, and we'd be happy to speak to anybody that has individual questions. The point is, cost will not be a barrier to receiving services at Aspen Valley Hospital. And that is our commitment as your community hospital. So those are all the symptomatic tests that are our highest priority for those that already are experiencing those symptoms. Let me talk next about asymptomatic testing, which I think everybody's becoming familiar with the term. That means you're not having symptoms at all yet. Simply stated, the testing that we're going to prioritize in those cases are going to be directed by public health. And so we obviously, if you are in close contact with, as Josh was describing earlier, with somebody who has tested positive, you may be identified in the contact tracing process. As Josh said, that's a 14-day quarantine. In addition to that, your public health epidemiologist or advisor may also request that you get a test. And that's for the purpose of identifying whether it has already spread or been transmitted beyond that first individual that tested positive. So those tests will be sent to us, and we will administer those for you. Another example where the county might refer individuals to us for testing is outbreaks. And so if there's a local business or organization that has 2 or more positive tests among its workforce, they may consider that to be an outbreak, and once again identify individuals that appear to have been in close contact more than 15 minutes within 6 feet, and refer for testing to get their arms around the extent to which there may have already been spread. But that is all directed by Pitkin County Public Health. And there's another role that we serve with public health as well as part of the overall containment strategy, and that is testing vulnerable populations that are still asymptomatic, that are, for example, at the jail or the homeless shelter, that are in close proximity with one another, congregate environments where there's a concern about the virus spreading in those cases,
at Public Health's direction, we have already gone in and tested the individuals and the staff to make sure that the virus isn't already present, and then may go back later, because one of the things to remember is that the test is only helpful for a point in time. And so even if let's just say an individual that's been sent to us for testing because they've been in contact with an employee who tested positive, even if they are negative, first of all, there's a 20 to 30% potential for that result to not be accurate, because the virus may in fact have already infected the person, but it hasn't replicated to the point that it's created viral load sufficient to be picked up by testing or even symptoms. So that's the first thing to remember. The second thing to remember is even if the test is accurate, or we assume it's accurate, you could go out and be infected the next day. And so there's a real risk to negative tests creating a false sense of security. And that's why it's very important to talk to your physician about what it means. And above all else, continue to adhere to the 5 commitments with or without a positive test. Generally speaking, it takes about 5 to 7 days before, once an individual is infected, before they might start to have a positive test result. And so the county health department will often wait for that period of time before referring an individual for a test, even if they are exposed or a close contact, just to reduce the likelihood of a false negative test. So again, such an important concept to work with public health and to work with your physician to understand the limitations of the test. Which brings me to the last point that I make, and that is we do also just provide asymptomatic testing when you're referred by your physician for a whole myriad of reasons. These are with a physician referral, not involving public health. You don't have any symptoms, but perhaps you're getting ready to travel to one of the states that requires a test upon entry. Maine and Alaska are 2 of them that I'm aware of. There may be others. And so plan ahead and contact us, schedule a time to come in and get tested, make sure that we allow enough time to get the results back, because we aren't going to use rapid tests in these situations. We only have a limited supply of tests that we process in-house in our own laboratory, which is what makes them rapid in terms of the results. And we can't afford to utilize those tests for situations that aren't critical to the health of the patient or the containment strategy of the county. So that's where we reserve those tests for those purposes. We will utilize a send-out test, typically saliva, if you are coming in to get tested because you're traveling, or your grandmother is coming to visit and you want to get a test before you arrive, or you are concerned that maybe you have been exposed, but you don't meet the definition or haven't been approached by the county as having been exposed, but your physician and you agree that it would be wise to get tested anyway. There's many, many different reasons why people are coming in for a test. We do require a physician referral for that. And again, we will not be utilizing our limited supply of rapid tests. We will be sending those out. Most typically, they're performed with a saliva specimen. So I believe I have covered the points that I wanted to make, and I will pause there and see if there's any questions or clarifications.
Great, thanks, Dave. We've got a few minutes left. I wanted to very quickly, a couple things that came up. One is regarding vulnerable populations testing at the Public Health Department's direction. I had a question come in from somebody who's concerned about the schools opening. Things have changed even today with the governor's new mask order, and the concern we're hearing about the increase in cases. We haven't heard from the school district in the last 20 minutes about what they're doing, but I'm sure they're looking at this and thinking about it. If necessary, testing would happen for individuals at the schools. But I'm thinking, who directs opening and closing of the schools? This is the school district. This doesn't have much to do with public health or hospital. I guess public health can issue an order regarding schools.
Well, I can only speak to this as an observer. I have been involved in discussions between public health and the school districts, and I know and the local community college, Colorado Community College. I know there are very close working relationships there and shared strategies. So it's not resorting to orders or anything like that. It's just public health supporting these educational institutions in reopening. And to that extent, Greg, we don't currently have an arrangement whereby we are going to be testing students or other individuals, but if we are requested to do so by them in the county, we'll be happy to assist with that process.
Great, thank you. And I'm sure we're going to hear more about this as we go forward. Okay, Tracy, you don't have a lot of time left, so I'm going to give it to you.
That's all right. I guess you want to see me talk really quickly. So, Andrew, if you can kind of put up those slides on the governor's mask order. So if there's anything that happens, honestly, daily in this process for us is some kind of change comes through or something new is lifted out there. One thing I will share with you, though, too, that was kind of cool today, my colleague at the city of Aspen, Missy Rapkin, so can you go to the next one, the mask slide there about the governor's ordinance. But my colleague, Missy Rapkin, got some great coverage for Pitkin County and Aspen today. She's got a great campaign for social distancing around town on yard signs. And in fact, the governor took and amplified that message of those yard signs today on his channels, which I think is great. It's getting a lot of good coverage, and it's just a good reminder to all of us there's things that we can do to practice the 5 commitments. So great job for Missy and her team. So the governor issued statewide mask order is effective midnight tonight. And clearly there's going to be some more information and guidance that we're going to get, but go ahead and go to my next slide, please. But what it is, there's about 40 Colorado cities and counties, as we know, that have local mask ordinances. The city of Aspen and then also Pitkin County has had one for a while. The statewide order sets a clear standard, especially for tourists or visitors, and that's something that is been discussed quite a bit. How do we get people that are visiting us come into compliance? Well, the governor's order is going to kind of be putting that kind of mandate down, and then there will be the opportunity for local communities to be more restrictive or have other things around the mask order. But that again is guidance that just having found out about 45 minutes before our meeting, our public health team is going to look into very deeply. So go ahead and take me to the next slide, and it's actually my last slide, so I'll go quickly. Thank you for hanging in there with us. So what we should know is not really changing for the order we have in Pitkin County and Aspen is, masks are still non-medical cloth-based coverings that cover the nose and mouth, and they're required to be worn in public indoor spaces. When outside on trails, because we get this question quite often, masks are required if there's a risk of being 6 feet within the frame of another person who's not of the same household for more than 10 minutes. So public health is really digging into that 10-minute time frame. If you're passing someone on the trail who doesn't have a mask, you're still in that low risk box for getting COVID, unless somebody does something very rude like sneezes on you, and we know that APD and sheriff would be looking at that in detail. So what is changing with the governor's order is, in addition to indoor public spaces such as grocery stores, retail, restaurants, while being seated, that is required currently in Pitkin County, the state order expands this requirement to when you're in your office, in lobbies of buildings, elevators, indoor businesses, common areas, and gyms. He says except while using an indoor pool. That would be pretty hard to do, I think, with a mask. And then also while receiving personal services. So it's also this governor's order will mandate that businesses must post signs that would refuse service to people not wearing masks. So you can see the state is taking a pretty, getting ready to be a little more heavy-handed on the mask issue. And as you saw earlier, we have the I Wear a Mask campaign. We really want this to become part of the culture for Pitkin County and the Aspen area and Basalt and Redstone. We just need people to know that we want to keep places open and healthy and people and individuals in our lives healthy. So help us with that with the mask. There will be more information coming on our website, the pitkincounty.com website, and you go to COVID, especially as we kind of dig into what the governor has put out and what the guidance looks like moving forward. So don't hesitate to check back there. So Greg, that was my super fast roundup of today's meeting, and I'm going to kick it back to you.
Great. Well done, Tracy. Thank you very much. Other comments and questions that come in, I can just share since we're on a public forum here. One is from a very prominent local official who suggests we eliminate the 10-minute language because really what we want people to do is wear masks. 10 minutes is not a magic number. If you're in proximity to somebody for 9 minutes, I'd say your odds are pretty close to the same as they would be if you're with them for 10. So it's possible. That's a comment. The other comment was, has short-term housing rental rules changed? And they haven't changed with this order. And since I don't think the last update, I don't believe they have changed, but I can't reiterate them for the caller right now. We have to dig in, and I think it's probably on the county website, unless you have it at the tip of your tongue, Tracy.
I don't. I think you're right. There hasn't been a change, but we do know that next Thursday, Board of Health is meeting again, and obviously a lot of these topics come up at those meetings for consideration. So again, hang tight. There hasn't been a change in that. There hasn't been a change with short-term rentals with the public health order at the moment, but that could all change next week.
The last thing, just wanted to wrapping up here. I think pertinent information for people to know is that hospitalizations have been up and cases are on the increase. Eagle and Garfield County, four hospitalizations. It's just something for people to keep in mind. Eagle County 3, 0 in Aspen in the last 7 to 10 days is what I think we're hearing from Dave. But we've had some positive results that may not be Pitkin County residents that aren't indicated on our charts. You don't have numbers you can share on how many positive cases come in that we might not be seeing in some of the stats? Are there positive cases that we just don't know about that are coming through because they don't live here and they're not residents? Just want to verify that. I just had a question about that, Dave, if you don't mind, before we go. Are there positive cases that we're not hearing about?
No, I don't believe so. And as just a point of clarification, we have had we had a transfer out. We have had a couple of admissions in that past 10-day period of time. So I'm sorry, I got an update while we were
transfers out.
Yeah, somebody and a couple of admissions, but for COVID-like symptoms, I got an update while we were talking from one of our staff. So I didn't have the most current data. But to answer your question about positives, that are, yes, absolutely. We are seeing people that we are testing, that we are taking care of at our emergency department and our respiratory evaluation center from out of the area. But I think what's important to note, though, is that they are reported to the public health department to manage those situations, because it's not always clear whether or not somebody lives here or has because we have so many part-time homeowners and second homeowners versus people that are just here for the weekend. So we don't differentiate whether or not they are truly a resident of Pitkin County and thus where they fit into the statistical representation. We let public health make that determination when they do their interview.
So public health is tracking that. That's not something that's slipping off the table.
Oh, okay. I should probably be more clear. No, they are not falling through the cracks. We report them all and leave it up to public health to determine where they fit statistically in the information you're seeing presented on the website.
Great, thank you for that. Okay, then I think we're wrapping it up here. Everybody listening today, thank you. We got about 70 or 80 people on this call. If you have an opportunity, take a picture with your mask and send it to us at pio@pitkincounty.com, and maybe give a brief explanation on why you think it's important to wear one. We'd like you to share that publicly and post it on Instagram and Facebook as well. I think modeling best practices and good behavior will be as important as everything else we're doing here. Thank you all very much, and I think we're going to wrap it up. Thanks, Tracy. Thanks, Dave. And thanks to all of our panelists that were here today. And that's it for me.
Thanks, Greg.